I got my balance back and I had to owe money. And I said, no, mine is normally $0. And they said, well, you're on the brand drug now. And I said, no, well, I want the generic. But it's just arming yourself with those resources and knowing that stuff, or I would have never known to say that or ask for that.
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
who spend their working days focused on health benefits and health care.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefit systems. I'm Jolene Myers.
And I'm Sarah Flusky.
And we're ready to lament,
complain,
empathize,
and maybe help a few people.
Carly has been working in the pharmacy benefits management space since 2018. Like me, she hopped in with the skills to do her job, but the benefits industry was new for her. We asked her what she likes about working in insurance because no one as a child ever hopes that they're working in the insurance industry. And Carly's answer speaks to why, if you think about it the right way, it could be an aspiration. She said, it's an industry that impacts everyone in one way or another, and I thoroughly enjoy helping others understand the complex world of pharmacy benefits. And now you see why we invited her. All this, plus she's really practical, down to earth, and we knew she could help us tackle a quick conversation about pharmacy benefits.
Welcome to our podcast, Carly. We're happy to have you with us. So we understand roughly that there are different tiers to medications and then different copays. We know we have pharmacy benefits, but we are here to, listen to you tell us about what you know. So before we jump into all of that, can you first explain the difference between a pharmacy benefit and a medical benefit? Because I think there's some confusion there sometimes. So let's get into it.
Thanks for having me, Jolene, Sarah. Great to be here. I would say that you nailed it. This world is very confusing and this industry can seem very overwhelming at times. And I'm sure you guys on the medical side, you understand that as well. And I think when I started in this industry, I thought it was all the same. I had no idea there was a separate company that did my pharmacy and my medical. I thought it was all combined into one. So it was very surprising to understand that I worked for a company that I didn't even know existed before this. So it was very different. So the difference between a medical benefit and a pharmacy benefit is exactly the point of sale. So whether you're getting it at your pharmacy or you're getting it through your medical or your doctor or your prescriber, it gets a little hairy when you talk about channel management. Channel management is something that your PBM does for you. And basically they decide if it's going to go through as a medical benefit or as a pharmacy benefit. And they look at a lot of different factors in that. Is it more expensive to go one way or the other? The convenience of the member. Is it easier for them to get it at the pharmacy, or is it maybe an injectable that they would be more comfortable getting at their doctor's office? So a lot of the time your PBM will look at a lot of different ways to think about, okay, what is the best channel for the member, for the end user? But it comes down to a few major things: cost, ease of use, what's the easiest place for the member. And a lot of them are injectables that a lot of members aren't comfortable doing themselves. So we'll send that through on the medical side. But you don't see any of that in the background. You only see the end user gets. So when your PBM is doing all these things in the background.
I feel like that brain exploding emotion.
So let's talk about what's a formulary, because that's a word that you hear. And again, right, if you're not familiar with it, you don't know what the heck it is and how it works for you and your plan. So if you could describe that for us.
I had no idea what a formulary was when I started here. And still, I always laugh because every time I type the word formulary, it says it's not a word and it's misspelled wrong. So you're not alone in people not understanding what it is. Even the dictionary doesn't really understand what a formulary is. And in the most high level definition, it is just a list of drugs that your PBM covers. That is it. So most PBMs are required to put their formulary on their website. So you could really go to any PBM's website and pull up their formulary right online. And it has a list of all the different drugs that are covered and the copay tier that those are on.
So I have learned, since I have understood that there are two separate companies and that the tiers relate to copays, that when a provider prescribes something, I do ask them what tier what tier drug it is, just because I want to know before I even go there, especially in a high deductible plan, like how much am I shelling out? Is there a comma, or is this like, it's been around for 60 years and I'm good?
No, exactly. And it's funny because I obviously get prescriptions too. And it wasn't until I started working for a PBM where I got my balance back and I had to owe money. And I said, no, mine is normally $0. And they said, well, you're on the brand drug now. And I said, no, well, I want the generic. The generic was free. And so if I wouldn't have known to ask for that, I was paying the $25 for my prescription and not knowing that there is a generic equivalent that does the exact same thing that they could have prescribed me. That would have been zero cost to me, zero cost to my plan. But it's just arming yourself with those resources and knowing that stuff, or I would have never known to say that or ask for that.
100%.
So what if your medicine is not on the formulary? What happens?
So we have a really awesome process. It's called a prior authorization. So if you go to the pharmacy and your doctor prescribes you XYZ drug and you go to pick it up and the pharmacy tells you, no, this is not covered. What happens is automatically our system is notified and there's a PA in process. So it's called a prior authorization. So our prior authorization team is staffed with, I want to say 8 to 10 amazing pharmacists. And they have a procedure where they check it to make sure the drug is appropriate for what the doctor prescribed. So if, they have, say it's acne and the doctor prescribed an acne cream, they make sure that all those steps are in process, although it looks correct. They also look if there's any equivalent on our formulary. So we go through our formulary to see that all of these drugs on there are not only cost effective to the member, but they're also efficacy. We also look at the, if there's other alternatives, we take that all into fact when we create the formulary. We also meet with a committee called the P&T committee on a quarterly basis, and that is 8 to 10 independent pharmacists, healthcare providers, all doctors, all relevant industry experts. And we work with them to create our formulary. So any edits we make to our formulary, we go through an independent committee to make sure that what we're doing is right for the member. So our kind of mantra is the right drug at the right price at the right time. If I was pregnant and I went to the pharmacy and there was a drug that the doctor prescribed me that a pregnant woman shouldn't take, the PPM already has those safety edits built in. So it would stop at the point of the sale right there to make sure I would not get that drug. And there's many different stuff we have built into the system that we call them safety and clinical edits, but you would never know behind the scenes that all that stuff is going on.
What have you learned about pharmacy benefits that helps you to be a better consumer or a better patient? I know you touched on a few points already, but like you said, there's a lot of chaos going on behind the curtain. And you've been at it a while now, so you could highlight a few of those points for us.
I think the biggest thing I've learned is that the news can make it seem like the healthcare industry is out to get you, and there is no one out there that is actually looking out for your best interest. And I think sometimes, and I'm sure you guys feel the same way, it can seem depressing. It's like, this is happening, pharmaceuticals doing this, medical is an all-time high spend. I think I've now learned working in the industry the last 5 years that there are so many companies out there that actually put their member first and the member's best interest first. A lot of companies, I know that their bottom dollar is the most important thing to them. And that's true. There is a lot of companies out there that they're more worried about what's in their pocket at the end of the day than their members' health. But I would want people to know that it's good to ask the questions. Don't ever think a dumb question is a thing, because the healthcare industry is convoluted and confusing. And sometimes I think it's like that on purpose, so people don't ask questions and just go along with it. So I think the most important thing is to don't be afraid to ask questions. There are so many resources out there for you. Your healthcare providers, they are a vast resource. Ask questions, figure out your copay, figure out what drugs are covered. Understand before you go into the doctor's office how much you're gonna pay. I think arming yourself with knowledge to the healthcare industry is the biggest thing, valuable asset you can have. But at the same time, I understand how scary it can be because before I started here, I couldn't have told you what a high deductible health plan was, and now I'm on one, and now I understand it. But it took a long time to understand that. But I asked a lot of dumb questions.
There's a lot of Googling involved, I think, with what we do.
Yeah,
Even before we had you on this, I was like looking up different terms and, because there's just so much to it and you're constantly learning.
I will say sometimes lawmakers don't fully understand the bills and the acts that they're producing, that they don't actually help what the issue
Amen.
is, and so sometimes I'm like, oh gosh, it's, people making laws for an industry they don't even understand or care to understand. So it gets a little frustrating sometimes being in this industry, like I'm sure you guys, I said, you experience. But it feels very good knowing that at the end of the day, I work for a company that really does take our members first. We care about their bottom line, the group's bottom line, and we care about the member having a positive, healthy lifestyle. That's our three most important things. And at the end of the day, like I said, sometimes it can be depressing seeing all the news and hearing about all these terrible stories. But it's the one story where you hear a member getting their prescription in an hour and because it was an emergency, or our customer service team reaching out to get someone a baby formula and reaching out to 50 different pharmacies to find formula for this woman that needed it during the time where formula was nowhere to be found. So there's those nuggets, there's those awesome stories that make me realize why I'm working in insurance after 5 years. Why am I still here? I rethink about those stories and it reminds me.
I also think it's interesting, the point I think, Jolene, you brought up about what's the difference between your medical benefits and your pharmacy benefits, because I think until I started, oh my gosh, over a decade ago, I knew there were two different logos, right? There's your network logo, and then there's the logo for your pharmacy benefits manager, your PBM. I never looked that up, but I feel like now it's probably something I would go and look up and check out. Well, what is their service to me, and how my pharmacy plan is not the same as my medical plan. And so what does that look like? And who is this pharmacy benefits manager? And what resources do they have out there for me? And what forms and things do I need access to? And it's a different customer service number sometimes. And, it's just another set of resources that people can arm themselves with. So I feel like take a look at your ID card and Google that logo if the website's not on your card.
It's kind of like reading Rainbow for adults. Like I looked at the full benefit summary for the drug formula that I have, because I'm on an HDHP plan, and I have hypothyroidism, so I'm on levothyroxine, and I know that that's a tier 1 drug and that I pay $30 for a 90-day supply, right? Because it's maintenance medication, There's another acronym in there. But, again, work in the industry, so you kind of go, oh, I could check that out, where a normal person might go, what? So it just opens up this world of information, whether or not it's geeky, but you're paying for this stuff in one way or another. So you gotta own it a little bit. And I think that's the whole, we've had discussions about changing behaviors as a society. And the more you know, people, with the star and the rainbow in the sky, right? So I think if we start looking at our insurance in that way, we're going to get into the price transparency tool later on in the season.
Woo.
I think if we start really looking into that stuff and understanding it a little bit better, things might make more sense and change will come, because, there's always dollars and cents attached to some of this stuff, and it's not always attractive, but if we can start educating ourselves a little bit more about what's going on, might change.
And don't do it until it's the one thing I would add is don't do it till too late. Don't start doing the research when you got a $1,000 medical bill and you got to figure out, is this correct? Does this make sense? Don't wait until you need the information to find it out, because and I think another thing When I came into this industry, I thought that healthcare knowledge and understanding your benefits was common sense. I thought everyone understood it, and I was kind of the young 25-year-old that didn't get it, still on my parents' health plan. Like, I had no idea. I know my parents paid my healthcare, and I didn't second guess it. That's all I knew. And so I guess just don't assume that you're the only one that doesn't understand it, because most of the population has questions and they're just too afraid to ask it. So don't be the one that's too afraid. Call your providers, like Sarah said, on your healthcare card and start asking the questions.
Yeah, there are no bad questions.
No, only good ones.
Well, thank you, Carly, for joining us and sharing your expertise. I'm sure we'll be reaching out again to maybe have a second piece to this, because there is a lot to talk about in this space. That's for sure.
This podcast is brought to you by Nova Healthcare Administrators.
Do you have a question or a situation you'd like advice about?
You can find us on Twitter at UNDR The Coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like, or subscribe, but more importantly, share.
We'll find the insiders. You share it with the outsiders.